Hey guys, I'm Yulia and welcome back to another episode of Nerdy NP Car Chat. Today we will be discussing some concepts that are relevant to understanding heart failure, and predominantly those are contractility, preload, afterload, cardiac output, and stroke volume. So first off, contractility is how hard does your heart muscle pump or squeeze to get blood out. The second one is preload, and preload is how much blood is returning back to your heart with each cardiac cycle and is available for ejection to your organs. The afterload is the pressure against which the heart has to pump. So how much resistance is there in the aorta, in the arteries that the heart has to pump against to eject blood out of the heart to your organs. And cardiac output is a formula or equation that takes stroke volume and multiplies it by heart rate, and that gives you a cardiac output in liters per minute, and that is essentially how much blood your heart pumps out with each cardiac cycle to your organs. And so the higher the cardiac output, the more perfusion there is, better perfusion to your organs. So cardiac output, right? Stroke volume, heart rate. Stroke volume is composed of two components. So you have your end diastolic volume, which is essentially your preload, which is how much blood is returning back to your heart. And you have your end systolic volume, which is essentially how much blood is left in your heart after your heart contracts and ejects blood. And so the higher the preload and the lower the end systolic volume, the higher your stroke volume, and the higher your stroke volume, the higher your cardiac output, and the higher your cardiac output, the more blood you have to your organs and the better organ perfusion you will have. So with preload, there are certain things that can affect it. One is how much volume you have in your body. So if you're taking things like Lasix, where you're diuresing and you're getting fluid off, you're going to have a lower preload. Additionally, if you're taking a venodilator like nitroglycerin or hydralazine, you're going to be dilating those veins, and so you're going to have less blood returning back to your heart because that venous pressure is going to be lower. And in contrast, your end systolic volume is dependent on two major things. So one is how much resistance is there in the arterial system. So how high is your blood pressure essentially? If it's high, then your heart will have to work harder to pump blood out. And so you may have less blood ejection with each heartbeat. And that will leave more blood in the ventricle, which will leave a higher end systolic volume. Additionally, if your heart muscle is weak because maybe you had a heart attack, or maybe your heart is weakened over time due to high blood pressure, your heart isn't just going to be not able to contract as hard. It's going to be weakened. The heart muscle will be hypertrophied, and therefore it's going to be in a weakened state that cannot physically contract as hard. And so those two things primarily influence how much blood is left over in your ventricles with each heartbeat, and that is your end systolic volume. So to recap, the higher your preload and the lower your end systolic volume, the higher your stroke volume. And the higher your stroke volume, the higher your cardiac output. And the higher your cardiac output, the more blood flow you have to your organs, the more oxygenated blood is getting to your organs, and therefore better organ perfusion and better organ function. So in the next episode, we will be focusing on the difference between right and left-sided heart failure. And so I hope you join me on the next episode. And if you like this episode, please subscribe and like below. And I hope to see you next time.